What are the different types of dental x-rays and how are they used? Depending on the purpose or what are we diagnosing, right? What is the problem that the patient has? It could be a small x-ray. That small x-ray will be showing your teeth, either the teeth coming together and it shows both of the teeth, the coronal aspect of it, or it can show the entire tooth with the root and with the bone around that root. That is one type of x-rays. It's called periapical. Peri means around, apical means the apexes of the root of the tooth. There also could be called a bite wing. Those are the x-rays that they ask you to bite on, and it shows top and the bottom teeth on the same image. The bite wings are the ones that you can see the cavities on. When it's a periapical, when the entire tooth is shown, we can see the roots and see if there is a cyst growing on the end of the tooth, or if there is in the bone there is some kind of formation. Now the surgeons like to use panoramic x-ray. Panoramic x-ray is the x-ray that goes around your head, and you can see most of the teeth that the patient has, including with the jawbone. So that is the x-ray for that. There's also a temporomandibular joint x-ray, the x-ray that shows your side, and it shows the relationship between the lower and the upper jaw and how do they meet at the joint here. The next x-ray that we have is called cephalometric. Usually the orthodontists take that. That is a side view of your face and basically a profile x-ray, the entire profile. And that also shows the relationship between the upper and the lower jaw and how it relates to the entire skull. There's also three-dimensional x-rays. This is three-dimensional x-rays that could be used like a CAT scan, right? Slices of the x-ray, different increments, and could be very small increments or larger increments. And those are used to see where the bone is and how wide the bone is. If they were looking to get implant placement, you want enough bone on either side of the implant, so you have to select the correct size of the implant. Right? It depends on the amount of bone that you have in that area. So those are the different types of x-rays. I hope that's been helpful.